And we're live.
Welcome everyone to our incredible Chiral community. I'm Laura Waghorn, the Sales and Training Manager here at Chiral. Now, Honey would normally host this call, but Honey isn't feeling very well today. She has completely lost her voice. So let's send lots of love and healing vibes over to Honey. So as you may already know, we've recently started offering personalized prescription hair loss medications. So today we won't be discussing the specifics of those products, but we do want to teach the community everything we can about hair loss. So with that in mind, today we'll be diving into Hair Loss 101 with Dr. Sanober Doctor. Now, you may remember Doctor, yes, it is Doctor, from a few weeks ago when she shared insights on Skincare 101. So for those unfamiliar with Doctor, she is an incredible dermatologist with dual board certifications in anti-aging and hair loss treatments. So beyond skincare, she addresses broader aspects of health and vitality, aiming to empower individuals to achieve their optimal well-being. So Doctor, thank you so much for joining us today. So just please tell us a little bit about yourself and your experience in the hair loss field.
Hair loss is actually one of my specialties. Like where I got training, we used to see, we had a dedicated hair loss OPD, outpatient department, where we saw literally, sometimes we had 200 to 300 patients a day. And it was, I think I can close my eyes and now when a patient walks in, like know exactly what is he going to complain about. So.
Oh, that's fantastic, and having that experience of being able to help people with their hair loss journey is fantastic. So let's get started. I know we've got some really great questions for you, just to educate our community on the hair loss aspect. So could you explain the different types of hair loss that people commonly experience?
Yeah, that's a great question. So generally when people come, they'll come with the symptom of losing hair. And that could be in the form of just losing hair in the shower or while they're combing, or they might actually be able to see bald patches on their scalp. So this is the kind of symptoms, most common symptoms that people present with, but it can manifest in various forms. Now, the most common complaint and hair disorder that we see in practice today is something known as male and female pattern hair loss, which is also known as androgenetic alopecia, or people might recognize this as age-related hair loss. It is said that approximately 50% of men and women will start experiencing it after puberty. So this is one of the most common hair disorders that we see. The other very common hair disorders in practice that I see includes alopecia areata. It is an autoimmune condition where the body starts attacking its own hair cells, and that leads to loss of hair in the form of patchy scalp, bald spots, or it could lead to total scalp hair loss, or it could even lead to complete body hair loss. Then we have something that is known as trichotillomania, which is this, it's kind of a psychological condition where the person has this irresistible desire to pluck out one's own hair. Then we also see telogen effluvium very commonly. We had touched upon this slightly during a previous call, but this is again stress-related hair falls. So anything after pregnancy, postpartum, after surgeries, any stressful in life that could lead to a temporary hair loss. So yeah, I think these are the major kinds of hair disorders that we see. But the other ones include like dandruff, a very common complaint that we see again, scalp psoriasis, seborrheic dermatitis. They come in with itchiness of the scalp, flakiness of the scalp, along with hair loss. So these are again a few of the things that we see.
Yeah, I can imagine you see a lot. So you just mentioned about alopecia. Could you just walk us through the different types of alopecia?
Are you speaking about alopecia areata or androgenetic alopecia?
Yeah, just to describe the difference between the two.
Sure. So when it comes to androgenetic alopecia, we have male pattern and female pattern hair loss. And the reason why we differentiated it is because though what is happening essentially is the increase in androgens within the body is leading to the loss of hair. but the way it presents in both the races is very different. So in men, how we typically see it present will be this M-shaped pattern or a U-shaped pattern where the hairline will start receding, or we might even see emptiness over the vertex, this top area of the scalp over here. And in women, you won't see the hairline really receding, but what you'll see is there'll be widening of the partition, the midline partition is a very common thing, or you'll see there will be patchy sparseness of the hair, like you'll be able to see the scalp through, like when you're combing. So it won't be as prominent as we see in men, but again, yeah, this is how it presents differently in both of them.
Yeah. So transitioning back to the general hair loss, what are some of the primary causes of hair loss that individuals should be aware of?
The most basic concerns, so androgenetic alopecia, I feel, is always happening in the background. Like whether we like it or not, there is always this component of this androgenetic component that is contributing to hair loss. But apart from that, what I also always tell patients and clients to pay attention to is nutritional deficiencies. Very commonly, we've seen certain uh, medications that they might be on, like blood pressure medications, chemotherapy medications, even being on oral contraceptive pills for a long time and then stopping it could lead to hair loss because that hormonal support is being lost. Then people very commonly having thyroid disorders will face some sort of hair loss or hair concerns. Iron deficiency anemia, because again, your hair is not getting those essential vital nutrients to develop and continue its cycle. So these are the very common things that vitamin D deficiency, that these are the things that need to be factored into when we are looking at hair loss as a whole and not only delineate a particular disease or an illness separately.
Yeah. So what's the kind of role of genetics in hair loss? How much does family history influence one's likelihood of losing your hair?
So if we're speaking about androgenetic alopecia, there's definitely a role of genetics and family history. In fact, it is said that if uh, you have your father's side having suffering from androgenetic alopecia, you're twice as likely, especially if you're a boy or a son yourself, twice more likely to develop it and develop it earlier in your life. Like if probably somebody started it in their 30s or 40s, you're even likely you're to start it in your 20s. So there is definitely a component. That's because we have this AR gene that is present in the X chromosome that is believed to contribute. But leaving that geeky scientific thing aside, we say androgenetic alopecia is polygenic in the sense that it's not only your genes, but many other such nutritional, environmental components that can contribute, the stress levels and all these things can contribute to the development of androgenetic alopecia. But genetics definitely has a role to play. And that's why whenever somebody comes and complains of hair loss, we always ask for the family history because we get an idea of how soon is it going to, how rapidly is it going to progress as well, and how should we like plan treatment and progress accordingly.
Yeah, that's interesting. That's very interesting. So, what are the notable differences in the causes and patterns of hair loss between men and women?
Yeah, so as we discussed, in men, it will be this M-shaped or U-shaped recession of the hairline. And again, a very common thing apart from that is loss of hair over the vertex. And in women, as I said, it will be like widening of the midline partition. That will be like the initial phase, and then slowly the sparseness. But I also want to point out that it's not necessary that this will be only in men and only in women. We have seen men present not with the typical M or the U-shaped loss, but have just sparseness of hair, and women present with recession of the hairline. So we always know there are exceptions to the rule. So what I described right now was the most common pattern that we see in the two, but it is not if and but, it is there's always a variety and a mixture. That's why an experienced eye will be able to pick up and see what exactly is this person having.
Yeah, definitely. They need that experienced eye. So can you discuss some of the common treatments for hair loss?
Sure. So when it comes to hair loss, again, we have to see the person as a whole and not only the hair. That's the way I like to approach it, and try to understand, is it only this particular disease or disorder that we're trying to tackle, or is there something underlying and more to it? Because most often we will see people coming in and continuously, and there are some brilliant treatment options that we will discuss. But another thing that I want to just point out and pay attention to is, if we are not going to correct an underlying disorder, something as simple as iron deficiency or a thyroid disorder or vitamin D deficiency or things like that, there are so many other things that can contribute, we won't get the maximal or the most effective results, right? And when it comes to androgenetic alopecia, we have oral and we have topical remedies. And I think everyone must be aware of by now because of the kind of awareness on social media. So topical minoxidil is the most common remedy that is used for the treatment of pattern hair loss. And when it comes to oral, we have oral finasteride. Today we also have oral minoxidil. So this is the very common prescription treatment that is available. Minoxidil is available over the counter too today. So, but this is like the basic one wants to start with, especially if we are talking about androgenetic or male or female pattern hair loss.
Yeah. What are some of the common side effects like associated with those hair loss treatments, and how can people like manage those side effects?
Now the side effects, again, the way an individual responds to the medication is very different. And it is a wide array of side effects that we have seen. And what I generally like to tell my patients and my clients when I meet them and I introduce them to these different options, I always like giving them their options and guide them what is the best for them, is some people like to avoid telling the side effects, in the sense it plays on the person's mind and then they become more aware that this is happening and then they report it even more. But I think that educating the individual will help us pick it up early if it is happening, and then we can work on it if required. So when it comes to topical minoxidil, we'll start with one thing at a time. So when it comes to topical minoxidil, the most common side effects that we have is skin irritation, redness of the scalp, a lot of flakiness, a lot of dryness, and this is very commonly seen due to the alcohol component that is present. That's why if somebody changes to the foam preparation of minoxidil, they will be able to mitigate or take care of that side effect at least, or reducing the frequency of application to some extent might help with that irritation or the redness that is associated with application. When it comes to oral finasteride, this is a very sensitive issue, especially when it comes to men of reproductive age. And that is what I always like to tell them, because it can lead to decreased libido, it can lead to ejaculatory disorders. And it's not that everyone is going to get affected. And even those who do are known to get used to it and get over it, in terms that the body gets used to and sensitized. And if they were facing that problem, they wouldn't face it any longer. But there are even men who have had it persistently, and it can become a permanent side effect. So again, it's a percentage of the population that does, but it does happen. So this is one thing that men have to keep in mind, especially when they're taking oral finasteride. And today we also have oral minoxidil available. Now, oral minoxidil was essentially introduced as a blood pressure lowering agent. And then they saw having hair growth in those who were given to lower their blood pressure, and that's how they realized that this can be used for hair growth. So it was the serendipitous discovery of minoxidil for treatment of hair loss. It was not actually designed to cause hair growth. So what happens with oral minoxidil is You will get hair growth over your scalp where you want it to be, but you might also experience hair growth on the rest of the body, which is not always very desirable. Also, since it is a blood pressure lowering medication, it can lead to decrease in blood pressure. It can lead to increase in heart rate. It can lead to dizziness. So that's why the dosage and it needs to be taken under the guidance of your dermatologist or your healthcare provider so that you can be monitored. And yeah, I think these are the most common side effects. I'm not trying to scare anyone since you asked me for it, is why I am sharing this. But yeah, it's good to know.
Okay, so we've just had a question come in. If you've been having hair loss for years, so let's say 20 years, can treatment still be effective?
Of course, it depends again on what kind of hair loss are we dealing with. Until and unless, I always say, until and unless there is scarring, that means the stem cell that gives rise to the hair follicle is lost, there is always a chance for hair regeneration. But the amount that we can expect, the amount of hair regrowth we can expect is always different, and it depends on what stage we are treating it at. So if somebody comes in with a grade stage 6 or 7 hair loss and they want a complete head full of hair, it's not going to be possible until and unless you go for transplantation. And even then, it's going to be limited. So having a realistic expectation of where you are in your hair loss journey and how and to what extent can you get it back is always a thing that needs to be discussed, but it is always possible until and unless it is a form of scarring alopecia. That means there is scar tissue and there is no hair, the bulb or the hair root isn't present. You can always have hair regrowth back.
Okay, so that kind of leads me on to my next question. Are there any specific medical conditions or health concerns that would make somebody ineligible for prescription hair loss treatment?
So when it comes to medical conditions, again, it depends on what kind of medications you are in, what health concern you have, and whether that is contributing to your hair loss or are they just two unrelated things. So that is one thing that needs to be considered. But in general, as I discussed, oral minoxidil is a blood pressure lowering agent. So pressure lowering medications, you will not be an ideal candidate for taking oral minoxidil. And for that matter, even taking topical minoxidil will be fine because the amount of systemic absorption, the amount of drug that is going to enter will be less. But the scalp is a very vascular tissue. It has a very rich blood supply. So there will be some amount of absorption as well. So that is one thing that you need to consider and take care of. In general, I haven't really seen a lot of contraindication in apart from if I have women coming in with hair loss and they are of reproductive potential, or if they have their husbands who are coming in for really active treatment. So I tell them that again, as we discussed with oral finasteride, there can be decreased libido, ejaculation problems. So maybe that is something that you don't want to consider right now. And maybe once your family is completed, we can discuss this as an option, right? So that is one thing. Yeah, I think these are the very common basic things that we need to consider. Otherwise, until and unless the person is on something specific that is going to interfere with the kind of prescription we're giving, I don't think there should be a problem.
Okay, that's good to know. So I know many people are wondering if hair loss is actually reversible. Okay, what extent can individuals expect hair loss to be reversed through treatments, lifestyle changes?
Yeah, that's a great question because I am a firm believer of like I keep saying it again and again, but it's not only the hair that you need to concentrate, but we need to see the individual as a whole. So apart from prescription medications today, there is scientific evidence to some extent to show that having a protein-rich diet, having a good protein-rich diet, having collagen, good quality collagen, bone broth, all these things can help because ultimately hair is protein, it's keratin. So it will help with it, correcting your vitamin D levels, correcting any form of anemia in like if you have folic acid deficiency, iron deficiency, that can really help with hair loss. If you have any thyroid disorder, these are the basic things that you need to get corrected, and that will help with the kind of hair loss that you are having as well. Apart from that, everything, if you're having a systemic disease, your body is in the state of stress because it is trying to heal, it is trying to take care of something that is present, that is going on within the body. So you need to understand that that is going to take an effect on your hair as well, because the body does not consider the hair to be a vital organ. It wants to take care of your heart, your brain, your vital organs. So you might experience a transition of temporary loss of hair. So understanding what kind of hair loss you have, in what situation are you in, and taking care of it as a whole will really help in the long run, instead of just panicking or trying various things, especially when we see it on social media and that promises like head full of hair. It just doesn't work like that. I hope it did, but it doesn't.
No, because the hair has like a timeline of growth, doesn't it?
Absolutely, you're absolutely correct. It is, and it's a very long timeline. That's why people generally lose their patience. One hair cycle takes roughly 3 months to complete. And to see any visible growth, it takes 9 to 12 months, because the growth is going to be like so tiny. And then for it to be actually be able to pop out of your scalp and be visible is going to take that long. So whenever, another thing that needs to be done whenever we have a hair loss patient, so if there are any practitioners watching this, is very good amount of counseling, because people might lose patience, they might give up too soon and then try another remedy. But I think when it comes to hair loss, the most important thing, if there's anyone who wants to be serious about getting hair regrowth, is being consistent with whatever you're taking. And it depends on what you are doing for your hair loss treatment and therapy, but there is always something or the other that can help with hair growth. You just need to have the right kind of guidance and that understanding of what you're dealing with and how to go about it.
Yeah, I can imagine that process of waiting for your hair to kind of grow back through is quite frustrating. So I'd imagine the counselling side could be really important to that. So what's the connection between hair loss and weight loss? Is there a connection? You know, how do they relate to each other?
Absolutely, that's a great question, because many, especially young girls, they come in with hair loss. And when I probe further into it, like they're looking amazing. And I'm like, are you dieting? Are you like restricting something? Are you looking in excellent shape? And then I come to know, yes, they are doing things for weight loss. Now, as I said before, the body does not consider hair as a vital organ. So when we are going to restrict our calories, when we are going to restrict the amount of whatever we take, if you are dieting or for any reason, the amount of nutrition that your body was normally achieving gets reduced, it is going to divert whatever nutrients are available to the vital organs to help you survive, and not to your hair. So you might experience a transition, and that is telogenous fluting, where you might lose some amount of hair until the cycle gets regularized. You might continue to do so. So when it comes to weight loss, it has to be sustainable. It has to be, again, something that your body can take in, and it has to be gradual instead of just going in for rapid weight loss, because then you will end up losing your hair as well.
Yeah. So we've had another question come in. Somebody would like to know, is there vitamins that we can recommend while someone's taking an oral or topical serum?
Yeah, there are, I would recommend vitamin D and vitamin B complex, specifically when it comes to hair loss. Biotin is supposed to help, but the scientific evidence when it comes to these things is very poor, and whatever scientific studies we have, some of them are funded by the companies that make these supplements. So there isn't a lot of, if I say, what can I say, a lot of authority in these kind of scientific studies. But in my experience, I have seen that definitely having even something as simple as a multivitamin, if you're going through a stressful period, if you're going through telogen effluvium, the stress-related hair loss can definitely help your body get back those nutrients and help your hair regrowth and help your hair get back into the normal cycling process. But if you're talking about androgenetic alopecia, or if you're talking about alopecia areata, which is an autoimmune condition, or it is a hormonal condition, there the role of vitamins or minerals is not going to be much, but it can definitely be a supportive conjuncture. So that is not going to be a primary thing that I would recommend, but it can definitely help in the long run. But again, vitamins, any form of vitamin for that matter, I always say, doesn't have to be taken continuously, because your body will just store it up and not use it. So give it a break and then take it for some time, and then again continue seeing how your body is responding to it. You will see the results for yourself.
Yeah, that's a great answer, because I'm personally, I don't take many vitamins, and I probably should, because for overall general health, they must be just a benefit.
That is the common belief. But if you're having a wholesome, rich diet, again, now that's another thing. Like I keep saying this on my YouTube channel because that's where I get a lot of questions from, and the reason why I started it is because when the soil today is very depleted. So even if you're having the best produce, the most organic, the best things that we believe is like wholesome and rich in nutrients, it's not going to give us those amount of nutrients that our ancestors were getting. So apart from having a wholesome, balanced diet, supplementing in and out will definitely help you, but it's not something that you need to completely be dependent on.
Okay, so as we kind of wrap this up, is there anything else regarding hair loss that you want to share with the community?
Hair loss is something very, I think it is very concerning for whoever is suffering from it, because we know this mane, the beautiful mane that we've been gifted with, has been attached with a lot of aesthetic value, and it is very psychologically debilitating for many who suffer from hair loss. So my thing is, you don't have to give up, or you don't have to really get affected, because again, stress is the number one reason for leading to any form of hair loss and aggravating or increasing the condition. Uh, Sought the help of a specialist, and again a specialist who knows what they're doing, because today there are many on social media who tout. And the reason why I honestly joined social media was because my patients kept telling me, you need to correct the misinformation that's out there. And I love that you all are taking this effort to educate people on the correct measures and what is available and what is out there. So they need to understand what type of hair loss are they dealing with, and what are the various options that are available to take care of it, and then start the hair loss and hair regrowth journey accordingly. Because if you're just going to blindly try everything, and it's like shooting arrows in the dark, and as we discussed, seeing the results with hair regrowth is going to take time. So having this kind of understanding and then approaching it with a wholesome perspective is definitely going to help anyone with their hair loss journey.
Yeah, it's definitely a personal journey, isn't it? Everybody's
Yes.
going to experience something different. But we just want to remind you guys that no matter what hair loss journey you're going through, you're all still beautiful and amazing. That absolutely 100% you are. You might not feel it within yourself on that aesthetic side, but you are still amazing and beautiful. So I'm just going to leave it for a few minutes just to see if any more comments come in. But I really want to thank you, because educating people on this is such a huge factor, because there's lots of people who might be sitting at home and feeling shamed because they are going through this. So, educating and letting people know that there is a solution, that's a big thing. So thank you for coming on and sharing your expertise in that.
No, thank you for having me.
So I'm just going to wait just for a minute just to see if we have any more questions that come in, because I know it's a huge topic. Lots of people experience this, and it's a life-changing element for them, whether it's down to a hereditary or whether it's a medical, whatever the reason behind it, it has an impact on your day-to-day life.
Absolutely.
So it doesn't look like we've got any more coming in, but we will get, if anybody does comment on this post, on our live video here, we will be sure to check back in and answer those questions for you. I know Dr. Sanober, you really enjoy this topic, don't you? So I know you're going to be there to help answer anybody's questions. So thank you again for joining us today, and thank you for educating our community. It was lovely speaking with you. And we look forward to connecting with you again in the future, because you have such an expertise on such a variety of different things.
Thank you so much, Laura. Thank you.
So take care, everybody.